may impact Nigeria 5 years after, now that you professionals are heading back to London for another summit on the world population and finance in family planning?
Well, actually, the summit starts today, July 11th, and our team are already in London. And what is happening is that we are reviewing. You recall that in 2012, after the World Population Summit in London, there was a blueprint that was developed in Nigeria that was supposed to cover 2014 and 2018. That blueprint has been, we have looked at it and we have seen that we have underperformed on that blueprint. So what Nigeria has done is developing a sustainability plan, financial sustainability plan to finance family planning and sexual health reproduction in Nigeria. And I think that is the message we are carrying to the world, that look, we have not been able to achieve all what we have wanted to achieve during the 2012 commitment in London, but we are now here with other plans, with financial plans that we think will enable us to do better than what we have done before. I think that's the message which we are carrying through now.
Let's move a little bit away from the side of the government to advocacy. Groups and institutions like yours that's been at the forefront of this, ensuring that government keeps to its commitments at the local level in line with international best practices and guidelines and commitments. Bring us up to speed on some specifics along this corridor.
I think as civil society organizations and development partners have been on the forefront of advocating for increased government ownership and funding of family planning and reproductive health in Nigeria. Let's take specifically where I consult, that's the Partnership for Advocacy in Child and Family Health. We'll be able to do a lot of advocacies and capacity building in the focal state that we are dealing with, specifically in Oyo, Nasarawa State, Kaduna State, Lagos State, and about 7 other states like that, where our effort along some other partners has enabled the government to at least look at the need analysis for the family planning, develop what we call the costed implementation plan that we carry for about 4 years, as well as also developing the execution plan of this costed implementation, which has been costed, of course, What do we need to do in the next 4 years if we are going to achieve the family planning targets we have set for ourselves? What do we need to do in the next 4? What resources do we need in the next 4 years to make sure that we achieve? In Oyo State, we have had costed implementation plan. We have had execution plan. In Nasarawa State, that one has happened. We have had costed implementation plan, and they're also preparing for the execution. In Kaduna State, the same thing has happened. In Lagos, has had costed implementation plan. Just as at national level, we have had costed implementation plan. And I think what we are doing most is to advocate to the executive that they need to put appropriately, to budget appropriately for family planning. 2 is to also let them know that they need to release what they have budgeted. 3, and also to let them know that what is released is used for what it is meant for, and so that we are very transparent and accountable in the way we manage the resources. That's number 1. Number 2 is that we are able to support the civil society organizations or civil society world, and including development partners, be able to support states specifically on family planning infrastructures. In some states, health facilities were renovated. In some states, people were trained, and you build champions of family planning, even within the executive, within the legislators, and the influencers into society. And you make all of them like mini ambassadors of family planning. This we have been doing in PACFA, and they will continue to do that.
In terms of results, do you think, despite the fact that we haven't spent as much as millions of dollars as we ought to in the last couple of years, perhaps with recession and economic meltdown, do you think some success have been recorded in some states that have been able to, as you're trying to point out, maybe build new maternal healthcare facilities, and in trying at the states and local government levels to ensure that Nigeria help prevent a burst in our population and keep everything under wrap, as it were?
Despite the challenges, there are no doubt that there are successes that we have achieved in some states. If you look globally in the whole country, the Southwest geopolitical zone, for instance, had an average of about 34% prevalence rate of contraceptive, and the lowest being the Northwest, which is about 11%. Specifically in the Southwest, some states in Southwest like Oyo or Lagos have been able to increase their contraceptive prevalence rate marginally, I mean at least substantially, so that many more women are now enjoying family planning services. But that has not been the case all across board. What has been achieved is just very marginal. And if we go at the rate at which we are going, with the level of financing and funding we are putting into family planning, and with the level of ownership that is currently being enjoyed in family planning cluster, there's no way we can achieve the target we want to achieve. And the targets are quite laudable. The issue is that if we have very strong family planning schemes and strong family planning implementation, if we implement the various frameworks, implement the various policies and guidelines that we have set for ourselves in Nigeria, we will be able to reduce poverty, certainly we'll be able to create more jobs, certainly we'll be able to put less pressure on the facilities that are available, because you are going to have qualitative children. Don't let's forget that currently now Nigeria has close to almost about 30% or 40% of the population of the country are below the age of 25. That creates a very huge amount of people, young people, that are very dependent on the very people that are working over there. That is not good enough. So if we don't start now, we shouldn't forget also that these young people are also going to grow into the productive age where they also start having children. We need to take concerted effort, be very, very definite, so that we don't have a geometrical increase in the population. That we can prevent having Nigeria a population of 500 million people by 2050 by reducing current fertility rate, by budgeting adequately for family planning services, by increasing the number of facilities that are, that are offering family planning services, by increasing the human resources and making sure that we use the available human resources much more efficiently in the health facilities, and also by breaking all the socio-cultural and the religious barrier that are presently affecting family practice, planning practices in the country.
Dr. Abanikanda, thank you very much. Dr. Emmanuel Abanikanda, we thank you very much. A health specialist and a medical doctor. Thank you very much. All the best in London. And let's get together after the London summit and review this conversation a little bit with your takeaways from the summit. Let's come back to you after the break when we wrap up the program in a couple of minutes.